Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is December 13, 2025. This videocast is an article published in Lancet Diabetes and Endocrinology just yesterday, December 12th, open access, titled Prediabetes Remission and Cardiovascular Morbidity and Mortality, post-hoc analysis from the Diabetes Prevention Program Outcome Study and the Darking Diabetes Prevention Outcome Study. Prediabetes is associated with increased cardiovascular disease and heart failure risk. The hypothesis was achieving remission to normoglycaemia reduced long-term cardiovascular morbidity and mortality. It was a post-hoc analysis of two landmark trials, the Diabetes Prevention Program Outcome Study and the Darking Diabetes Prevention Outcome Study in China. Sample size 2,402 for the study done in the US and 540 individuals for the study done in China. Intervention: multi-component lifestyle intervention targeting diet, physical activity, and weight loss. The definition of remission: a fasting plasma glucose less than 100 milligrams per deciliter, 2-hour plasma glucose less than 140 milligrams per deciliter, and a hemoglobin A1C of less than 5.7. Follow-up: median 20 years in the US study and greater than 30 years in the Chinese study. The primary endpoint: cardiovascular mortality or hospitalisation for heart failure. Statistics: Cox proportional hazards models with multivariable adjustment and inverse probability weighting. What did they find? In the US study, remission reduced cardiovascular death or heart failure, hazard ratio 0.41, 95% confidence interval was between 0.2 to 0.84, p-value equals 0.014. Event rates were 1.74 versus 4.17 per 1,000 person years, that is remission versus non-remission. In the Chinese study, the adjusted hazard ratio was 0.49, p-value 0.010 for the primary endpoint. In the pooled meta-analysis, the adjusted hazard ratio was 0.47, p-value equal to 0.0006, no heterogeneity. Mortality: lower all-cause mortality was associated with remission in both cohorts. Limitation of study: it was a post-hoc design. Baseline differences between remission groups, relatively small number of events, strengths, long follow-up, diverse populations, consistent findings across cohorts. Key takeaway: prediabetes remission confers a durable, decades-long cardiovascular benefit. Clinical implication: remission should be considered as a therapeutic target alongside weight loss. Clinical pearls: prediabetes remission is more than diabetes prevention. It is cardiovascular prevention. Benefits persist decades beyond the active lifestyle intervention period. Remission captures the metabolic improvements beyond weight loss alone. An achieved fasting plasma glucose less than 97 may serve as a pragmatic clinical surrogate. Lifestyle interventions remain foundational, but remission-focused targets may refine prevention strategies. These are some eponyms. Hit pause and read at your leisure. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.